Hey everybody, welcome back to my channel. We're talking about Lyme disease, doxycycline, and do you start on doxy with an acute Lyme infection? So remember from other videos, if you've been following my channel for a while, that many people with an acute Lyme infection, they do not get that bullseye rash. So you can look online around your classic bullseye rash. You can find this on my blog at mylymedoc.com. But most people do not get that classic rash. So from that standpoint, if you are suspecting of Lyme disease, you do want to get yourself tested for Lyme. Remember, the first line care that is often used in conventional medicine has up to a 67% chance of a false negative. So if you've been bitten, if you feel like you've been in Lyme endemic areas, which actually are all over the country and even all over the world, the country being the United States, that's where I'm in, and all over the world, if you have Lyme disease or if you've been bitten by something, by a tick, you could have Lyme. This does not have to be in the New England states of the United States, in those huge tick endemic areas. Now we know it is pretty much everywhere. So you want to test, you want to get good tests. Remember, if you are having a hard time accessing tests, you can always do so through my group program. I will put a link about how to join my group program below, where you can get access to top of the line Lyme testing. But to actually get to the point of our conversation today around doxycycline. So doxycycline as an antibiotic is still to this day the first standard line of care for treatment in acute Lyme. And it can be a good idea, but my concern with doxy is that we see in studies that when you take doxy, much of that Lyme is converted into a different form, because Lyme can morph. The bacteria Borrelia burgdorferi that causes Lyme disease can morph into different shapes. And in these different shapes, it can hide. So one of the things that doxycycline is really good at is clearing the blood from the active form of Lyme, but it can also make Lyme turn into this dormant form at a very high rate. And so what happens oftentimes is people's symptoms go away and they feel a lot better. But then what happens in long-term chronic Lyme is there's something that is causing that Lyme morphology, that dormant shape of Lyme, to shift back into that active form. And usually in chronic Lyme, it does not look like acute Lyme, meaning it is not going to be your standard rashes, fevers, flus. Oftentimes it's going to manifest as things like fibromyalgia or autoimmune disease or headaches or migraines or strange neurological symptoms, chronic fatigue, and more. So a lot of times people are not thinking Lyme in the chronic because they thought they fixed it in the acute, so it doesn't even come into their radar, and many times they don't even bring it up to their doctor. So this all goes back to our point of like, what do you do with the acute? So in the acute, there can be good reason to use something like doxycycline. Definitely should be considered and in many times taken. However, what I do recommend for people is when they are doing something for acute, they are also doing other things to help with that dormant form of Lyme, so we're not getting the conversion. So when we're using things like doxy, it works really well to combine with an herb like cryptolepis, which works really well and way outperforms doxy for those chronic, persistent, dormant forms of Lyme. So when we use them at the same time, we're going after the acute active Lyme as well as preventing that conversion into that dormant Lyme, because we're going after those cells as well. And that can work extremely well. It can also work to pair with something like hyaluronic acid. So Lyme loves hyaluronic acid. And one of the things that Lyme will do is it'll swim, it'll burrow, it'll go deep into our tissues, because that is where the hyaluronic acid is. In our joints, for example. This is one reason why Lyme can cause a lot of joint pain, because it's going after that hyaluronic acid, which is its food, and fueling off of it. So when we give hyaluronic acid at the same time we're taking things like doxycycline and cryptolepis, the herb, what we're doing is we're almost using it as Lyme bait. We give the hyaluronic acid, those Borrelia then can sense that hyaluronic acid in the blood once it's been absorbed. Well, that is also when our Lyme killers are. That's where our Lyme antimicrobials are, right? So when we're going after that Lyme, we have that hyaluronic acid to bait it, to draw it out of those deep tissues. And then we have the antibiotic and we have the antibiotic herb and the antibiotic pharmaceutical to actually kill the Lyme. So that can also help in the acute. So remember, it's not as simple as just like killing it acutely. Like that's oftentimes what is done, but we really do want to consider like the long term and some of the long-term side effects we can see when we use an antibiotic. Now, of course, we always want to protect the microbiome, looking at being on a good probiotic, looking at being on a prebiotic, which is the food for the probiotic at the same time. Many people do well rotating through probiotics. So using a broad spectrum probiotic, using a spore-based probiotic like a Bacillus subtilis can really help to repopulate the microbiome. But what we see in microbiome studies is that if we give a probiotic and pull the probiotic, the microbiome is relatively unchanged, right? It looks the same as before we even started the probiotic. So if we kill the microorganisms of the gut, we give a probiotic and then we pull the probiotic, it's going to still look like we've killed a lot of the microorganisms of the gut. But if we combine it with a prebiotic, we get more of those lasting changes. Remember, the prebiotic is the probiotic food. So these are things like inulin, fructooligosaccharides, right? These are our prebiotics. And so with that, we can use that as then a way of repopulating the microbiome after we use an antibiotic. So I hope that's been helpful. Again, if you need access to tests, you can find my group program below in the show notes. Also, go take my quiz because my quiz is free. It's at getwellquiz.com. And if you go to getwellquiz.com, what you'll find is a quiz that will help identify Lyme as well as other root causes. It's obviously not the same as testing. I still recommend testing. But the point of the quiz is to help you determine because your symptoms, you might also want to consider this test or that test or that test. So it kind of helps to guide you with other tests you might want to talk to your doctor about and gives you insight on why those might be valuable tests for your situation. So again, that quiz is at getwellquiz.com. Again, not diagnostic, but just there to help give you additional ideas to talk to your doctor about and specific tests that might be related to some of the symptoms you are experiencing. Okay, everybody, it's a pleasure as always. Please do subscribe. Go to getwellquiz.com. I'll see you soon.